All right. Well, we'll jump in and we'll get started as we get everyone situated. We'd like to welcome you to Calcium's webinar with our special guest, Dr. Joe Donzelli. We'll begin in just a moment, but we'd like to give all of our guests a chance to share in the chat, which you'll see right to your bottom right side of your screen. Feel free to use that chat box. Let us know where you're from, what questions you have, or things that are top of mind for you related to chronic disease, other allergy treatment questions. We'd be happy to include those either at the end. We have a Q&A section for those of you with, questions as you're hearing what Dr. Joe is sharing. And, throughout the presentation, we encourage you to feel free to use that chat box to interact with us. We will make available an email address that you can reach out to with further questions after the presentation. But if we could go ahead and move forward to the next slide. We'd like to kick our webinar off. This week's webinar is called Preventing Chronic Illnesses Through Smarter Allergy Management. I'd like to welcome our special guest speaker, Dr. Joe Donzelli, an ENT head and neck surgeon out of Illinois. So welcome so much, Joe.
Thanks, Jen.
And just a quick background. Currently, you're at Dooley, which I know was formerly DuPage Medical Group, for those of you who might be familiar with that. Joe is also the founding partner of Masket LLC, as well as a Calcium Advisory Board member. We appreciate all of your insights there. And also graduate from Chicago Medical School and Rosalind Franklin University. So great breadths of experience that you're bringing to the table today. We're very excited to hear from you. And with no further ado, I'd like to introduce Dr. Joe Donzelli.
Thanks, Jen. Appreciate it. And certainly appreciate Calcium giving an opportunity to talk about allergies and how they affect chronic illnesses, which oftentimes we probably don't even think about. We're so focused on the allergy symptoms that are active for an acute allergic rhinitis problem, but we don't think about what is the trickle-down effect in the future as far as in chronic illness. So a lot of these topics, a lot of these statements may be known to many of you, but it is clearly obvious that allergies are here. They've been here for a long time, and probably now more than ever, people are more aware of allergic rhinitis symptoms because of how closely they mimic a lot of symptoms related to COVID. So people are oftentimes even questioning, okay, do I have COVID? Do I have allergies? The allergies, as we all know, do affect both the upper and the lower airways. And because of that, you may be having symptomatology in the upper airway, but you may be creating disease pathology in the lower airway, which may not actually surface for many years. And that will actually not be seen, will mostly be seen in patients who are adult onset asthma patients. As this last comment makes mention, 24 million people in the country actually have asthma, and a quarter of those are children, which are oftentimes exacerbated by allergies, including even brought on by allergies in that older population that I mentioned. It's often that I will actually say to a patient, look, we're going to manage your allergies, and it's not so much the, can we go back one on that slide if we could? We're going to manage your allergies, and those allergies are specific for current symptomatology. But what I'm really trying to do is I'm trying to improve your longevity of your lungs. So this way you don't fall into the category where you start getting recurrent bronchitis. And then those recurrent bronchitis patients pretty soon find themselves on inhaled steroids, and then ultimately become an adult asthmatic patient. The photo on the right is a picture of a tympanic membrane. It's a left ear with serous otitis fluid. You can see that we used to call this a beer ear, where it looked like somebody poured a glass of beer into the ear. That ear is retracted. In the posterior aspect, you can see the malleus, and then behind that, you can see the stapes superstructure in the long process of the incus. So you will see fluid in the ear, much like this in many of our allergic population, especially pediatric population, ultimately resulting in tubes in many of them. Next slide, please. So allergies and chronic illness. This is certainly, as I was leading into in the moment before, that asthma is one of those pure links, but allergies also tend to cause other chronic illnesses, which can affect not only day-to-day life, but also affect the bottom line for healthcare dollars. We know that allergic rhinitis is the sixth leading cause of chronic illness in the U.S., and this can generate an annual cost of $18 billion for Americans. The allergies, typically from my world, ear, nose, and throat, lead toward recurrent otitis media effusion, lead toward recurrent dizziness, lead also toward issues regarding chronic asthma and chronic sinusitis, as well as a simple common complaint of postnasal drip and throat clearing. Epistaxis is certainly one of those as well. We see many people in the office trying to come in for a cauterization of their nose, thinking that that's going to fix their bleeding nose. But the reality is if you don't control the underlying cause, which oftentimes is going to be allergies and or chronic superficial infection, in particular with staph, if you don't control those chronic causes, you will then result in future epistaxis and failure of your cautery. So we manage our patients with epistaxis with strong allergy management, as well as topical saline sprays and topical antibiotic creams. The picture on the right here is a reminder that allergies are not always allergies, right? So you have patients that come in with nasal obstruction. That nasal obstruction is going to lead toward a diagnosis through an anterior nasal examination that may come up with allergic rhinitis, and you start the patient on their management, but they come back and their symptoms are persistent. This particular patient came in with recurrent bloody noses and congestion. The front of the nose looked like pure allergy. The back of the nose with an endoscopy, which most people don't have unless they are an otolaryngologist, revealed this bluish mass that you see in the center of the screen, which turned out to be a juvenile angiofibroma, which, although is a benign tumor, can behave very aggressively, causing exceptional epistaxis, resulting in craniofacial surgery. So this is a point just to remind ourselves to, although it may look like allergies, may not actually be allergies. So we need to consider our differentials on every patient. Next slide, please. What about thyroid disease? Well, in thyroid patients, many of these patients have Hashimoto's, especially of our hypothyroid patients that we see. The Hashimoto's may not even be diagnosed, but if you start looking into family linkage and say, okay, well, how many of your family members have thyroid disease? Or if you're checking a TPO test, you may find that that patient has Hashimoto's. We have seen a lot of linkage between Hashimoto's as an autoimmune disease to food sensitivities. Now, they may not be true food allergies, but food sensitivities such as gluten, white sugar, and dairy tend to create more of an inflammatory response in the body, which in turn will then enhance the Hashimoto's. We've seen people actually change their diet and reduce their TPO antibodies by over 90%. Now, that may not rejuvenate active thyroid function. However, it oftentimes, once you get that antibody load down, you will then have a softer thyroid. Softer thyroid means that there's less lymphocytes. Less lymphocytes mean that you're basically in a situation where the thyroid will function without getting disabled in the future as quickly. So hopefully you would slow the degradation of hypothyroidism. Next slide.
A quick question, Dr. Joe, we have from the audience asking if COVID has impacted allergies and asthma. Could you talk about that a bit more?
Sure. So obviously COVID will create a immune response in our system. That immune response will then give you inflammation that is acute and then chronic inflammation. And so we see in our practice that COVID has created a lot of chronic sinus illness, as well as throat clearing, as well as cough, as well as sense of smell disabilities. And so then what happens is that it just acts like a trampoline, right? So you have COVID on top of the trampoline, and then the allergies jump on top of that. and that double weight gives you a springboard of significant symptomatology, which may not be a infection, but actually could just be a allergic rhinitis flare, which we all know that allergic rhinitis flare can then lead into future infections, not necessarily COVID infections, but bacterial infections, where you wind up needing to be treated with an antibiotic for, let's say, sinusitis or bronchitis. But that's a great question.
Thanks a lot.
Sure. So the next slide basically talks about what is this impact? How does it actually show itself to us? And the impact on quality of life is seen all around us. And so we probably see it in ourselves. We probably see it in our family members, those that actually, on a day seem to be real sleepy, just fatigued, not able to get a good night's sleep, or they're irritable and just unable to focus. Those common complaints are seen with allergies. And so oftentimes we see this in the school world as well. When kids come, the teacher will say, hey, Johnny's just not paying attention at school. Well, it just so happens that corresponded to a peak ragweed season, and they're out at recess playing on the playground. So I think that if we don't think about these sort of day-to-day situations of quality of life, they may not say, hey, I'm an allergy, but this is definitely an allergy-related phenomenon. Next slide. So this kind of just illustrates the same thing. There was a survey that was done in allergic rhinitis patients in Europe and in US. The first two bars are showing the combined Europe and US survey, which basically revealed that a significant number of allergic rhinitis sufferers revealed that their job performance was affected by those allergies. This is common sense. So, but here it is by data, and also the same thing applied to the childhood's activity in school, their productivity. At least 42% of those reported impact. Now, I think that number probably is even higher, but certainly in this study that shows that there is a significant component. In America alone, we've seen also significant quality of life issues in both sleep disturbance as well as level of irritability. And again, I don't think we have to look far to see that around ourselves from just even our own home. Next slide. So where's our challenge? Our challenge is to get better patient education. In today's world, patients want to be part of the team. The day of listening to the doctor and saying, okay, well, the doctor says this, and therefore I'm going to do that, is long gone. We know these patients have access to social media, they have access to Google, they have access to online medical searches, which basically they come in and tell us what they want and or start doing what they think is appropriate at home for their illness. So we want to find a safe way to integrate them within our team, because they are part of the team. They need to be part of the team, because that's going to drive success really high on management. So from our perspective on allergies, we want to kind of make sure that the patient is trying to, on their own, be their own detective, connect their symptoms to their exposure. This is most important in food exposures, but certainly important in seasonal exposures as well. Also, we want them, once we've initiated a treatment plan, we want them to actually have compliance with that treatment plan. So they need to be reminded that although they may not be seeing their symptoms completely disappear, that their symptoms may be improving. They may not even realize the improvement until they stop their treatment to see that their symptomatology then has gotten worse, which has resulted in them stopping treatment, which they thought never worked, but then when reality was working, keeping them in control. The treatment compliance is obviously driven by the improvement that they feel, and some of these improvements just don't happen fast enough for anybody, including the patient and the provider. But we have treatments obviously available to us, from medications that are over the counter to prescription medications to immunotherapy to biological therapies. All these are available. So next slide, please. So how do we go ahead and help our patients track their symptoms? And this is where recording episodes. Whether the old day would have been just like, carry a diary around with you, or check back in at the house at 8 o'clock at night when you're winding down for the day, and you want to rehearse in your mind, what did I eat today? Where did I go today? Why do I feel the way I feel? But again, it's just about being a detective, and it makes our job easier as providers when patients are actually involved in this from a team standpoint. Next slide. So journaling, that's perfectly safe and easy way to do it. But today's day, most people are looking for an electronic solution. There are many apps available that may guide them along this, including, as I was mentioning before, trying to track related symptoms to exposures, certainly looking at an allergy action plan. What can I do to remind myself on how to make my symptoms resolve faster, or even to prevent my symptoms. And more importantly, that would be the best thing to do, obviously, is to, if you know you're going into a high allergy area, and you're going to be reffing a soccer match in the afternoon on a nice September evening when ragweed counts are going up, you're going to want to pre-medicate. So that brings you into sort of integrating the pollen counts and tracking that. And so instead of actually trying to search that out, it'd be nice to have something just pop up on your screen and say, hey, I've got, pollen counts are going to be high today. I better be aware of that. Next slide. So technology-based solutions basically are just moving along in this direction. And I think that we in medicine are basically are at the forefront of integrating this. I think that in another decade or so, we'll find that the integration phase, at least the initial integration phase, will have stopped, and now we will just have the advancement of that integration. But today, we still have people existing in the old world of paper and pen, and the yes, doctor, I'll do whatever you want me to do, to the new world of, hey, I want to be involved in my treatment. I want to go ahead and actually, be active in preventing and creating a better health system for myself. So I think that concludes my part of the talk. And Jen, I think you're on next.
Thanks so much. And we have some additional questions that came in during, so we'll get to those questions right at the tail end here. So thanks for those of you who had submitted. So one piece you mentioned, Dr. Donzelli, was around the need to, connecting symptoms with causes, these auto alerts and reminders. And another big piece of that is engaging with patients. And the way that Calcium does that is through this personalized approach to engagement. We are very consumer centric. I'm sure lots of folks have come across the patient portals that are out there. They have very low engagement. Whereas, we've created a tool here, a series of, with the app, with a series of tools that we give to providers to really get deeper insights that will help drive better health decisions and drive improved outcomes because of the approach that we take. Our app is fun to use for people, and it's evidenced by the numbers you'll see here. We have over 120,000 users, 550 organizations using Calcium's platform, which in turn gives you just invaluable aggregated data, where you shared on your earlier slides, Dr. Donzelli, around being able to get some of the data, for just that health data, and some of those insights from patients to help inform care. Tracking medications, some of these, tracking observations like journaling and some of those kinds of things will add so much value, not only to the provider or doctors and patients as well. So we can go to the next slide here. So that patient engagement piece, and what does it look like to be next generation? Some of the instances where you would see this is you would be able to gather longitudinal tracking data over a course of weeks and months. It's, I don't know about everyone else, but when you go to an appointment, you mentioned trying to keep paper logs and trying to keep track of that. Patients forget those. They're not always accurate, but if you have something at hand that's easy to use, it's so much more, I think, more factual and also more useful on the whole. So, having that prompted, could we go back please, that prompted recorded information so they can then record that. We have a feature right now in the app where you can use the journal to track that. I've used it actually with all my dad's check-ins, and I've had myriad notes where I've actually been able to reference it back amongst providers and have very thoughtful questions and feel like a great advocate for care there. Patient activity data. So we have a lot of connectivity to wearable devices and smart devices that will help provide insights. Survey check-ins. So instead of having staff call someone, having just that automated process to save them time, getting medication data, treatment data from other providers, and then again, the programmed alerts where you can red flag and bubble up kind of patients that need possibly more attention before others. Next slide. And here just is an example of what that could look like in practice. When we walk through patients through a number of stages on their health journey, that gives them personalized care. They get that continuous monitoring. We gamify it using behavioral science to make it fun and enjoyable and interactive to keep them coming back. And then notifications and reminders, some of those alerts. If you go to the click for the next animation there, what this really results in for you as providers is this 360-degree view of patients, and it helps drive outcomes. It helps improve their results and also provides a better patient experience overall. So you'll be able to, get progress reports, alerts of any kind of critical care needs, and also just overall trend analysis and AI-based recommendations. So there's a lot of potential to tap into here. And I think, what you were sharing earlier, some of the challenges folks face and providers face with what this solution offers could be a very interesting, an interesting fit for folks to explore. So we could go into questions and answer time, Q&A time. We did receive a few, an additional follow-up here. Let me get those questions. So we had some submitted questions prior to the event, and I will just share those with you, and feel free, Dr. Donzelli, to respond accordingly. So one of the questions was, will improved allergy diagnoses, treatment, and management help us to prevent or roll back the continued prevalence of asthma?
Oh, I definitely think that one is very true, Jen. I think that we have noticed in many of our patients who show up, as I mentioned earlier, with adult onset asthma, that those patients may not have had quote unquote asthma in their teens, but they had, just a little bit of coughing here and there, and then progressed on into their 20s and 30s. And soon after that started getting bronchitis. Every time they got a sinus infection, they get bronchitis, and every bronchitis would lead to a cough, and then that cough would linger for several days, and then pretty soon that cough was lingering for a month or two, and they were on oral steroids and then inhaled steroids, and then they'd come off that and then get another sinus infection, and that cycle repeated itself until very shortly after that they're on prolonged full course asthma management. And so I think that if this is a huge part of what should be a very active campaign, which is to manage patients' allergies when they're young, and that they're presenting with upper airway symptoms and not so many lower airway symptoms. We know the lower airway is definitely involved at that time. And if we can control that early on, we will prevent long-term lower airway issues. So yes, I like that approach a lot.
It's a great point. That early insight really makes a difference there in the action. The next kind of question kind of ties in nicely to that. Let me just read that here. Doesn't this all require getting patients to better grasp how serious allergies can become if they're left untreated? And how do we get patients to take allergies more seriously?
Yeah, I think that more and more often that if you sit in front of a patient and they're coming in with one kind of complaint, let's say the complaint is, oh, I can't, I have ringing in my ear. And so they come in to see me for tinnitus, but yet if I just forget or don't ask the question about allergies, then they won't necessarily bring it up. But if I'm asking the question, hey, do you also have any seasonal allergies? Have you been suffering at all with congestion? And so then then oftentimes they're like, oh, I got allergies, but they're not that bad, so I don't treat them. And then we just have to take that extra moment and time to kind of, ask a few more questions, and then also present some basic treatments for the patient, to bring them into a position of where they need to understand what the future looks like for some of them. Not all of them, but some of them will head down that path. And so if we can kind of just, retune them into what their body is doing, because as much as they want to be involved in their own health, we also want to ignore our own health. So we want to ignore the fact that we have a drippy nose or we're throat clearing all day. And but again, I'd say COVID has brought that breathing to the forefront, because if you're clearing your throat, your coworker is going to ask, why are you clearing your throat so much? Do you have COVID? And so and it's obviously likely not COVID, but the bottom line is, I think that people are more aware.
Have you seen more of an influx of folks coming into your office as a result of some of those inquiries from coworkers, for example, where
Definitely. A day doesn't go by that somebody doesn't say that they're on the spotlight, that people look at them like they've got the plague whenever they cough and clear their throat, and they know they don't have COVID, but everyone's looking at them like they have COVID. So next time you're on an airplane, take a look at the people around you that are coughing and clearing, right?
very good point. It is fascinating too. I've seen you mentioned the whole point of we like to ignore our health sometimes, and at least from my experience, that it's a lot harder to ignore when there's data in front of you. If you're a data-driven person, there's notes in front of you that say I've documented this and I've seen this. Having that all within your hands does make it, I would imagine, makes a provider's job a little more easy, because there is that a little more buy-in from the patient that they want to do something about this rather than just let it go.
Definitely. I
Mhm.
think buy-in is a good term. And I think that is definitely on board. You're going to always find your non-compliant patient, the one who waits to the last minute to come in, but no, I like it.
Definitely. One last question, and I'll just remind the audience, if you had any other questions, feel free to drop them into the chat on the bottom right. But last question that we had submitted from earlier attendees was, what specific symptoms would you say signal something more serious like rhinitis?
Yeah, so I would definitely caution everybody to not necessarily think that allergic rhinitis is the only answer, because we all have had anecdotal cases when the patient comes in with a headache and sinus congestion, and you send them on their way treating them with allergy medications, and they come back 3 months later because the medicines aren't working, and they have some kind of brain tumor, or they have another cause for their headache. The same thing goes with nasal obstruction, as I showed in the photo. Just because you can't breathe through your nose doesn't mean that allergies is the only cause. And so there's a lot of other things besides allergies that can cause that. And a good physical examination will help reveal those things. And so that's one of the areas where, video consultation, video examinations just fall short. You cannot examine the patient thoroughly on a video screen. And so that, in addition to the patient who just has a little bit of a throat clearing cough tickle. And so that patient may actually, once you put your stethoscope on them, you may find that they're wheezing, or if you just ask the additional question, are you coughing up any blood? And next thing you know, you have to tease it out of them. But then, I had coughed up some blood the other day, and just some blood speckling, and that patient may have a lung cancer. So there's plenty of things that can be causing symptomatology that looks like allergies, and to get into a situation where you think that just because you have a hammer that everything looks like a nail.
It's a great point, and caution as well. So I think
I lost the audio.
Oh, can you hear? We can still hear you. Okay. So we want to wrap up. If there's any other questions, I think we have finished up any questions that we had. We will make this recording available afterwards. And if you would like to hear more or even get a demo for your organization, feel free to email Ray Villar at ray.villar@calciumhealth.com. Dr. Joe, it looks like maybe your connection's resetting there, but if you can hear us, thank you so much for your sharing your insights with us today. And if anyone in the audience has some follow-up questions or anything that we can help with, feel free to reach out to us.
I lost my audio, so if you can hear me, I've had a great time, and I'm going to sign off. Thank you.
Thanks so much, everyone. Thanks for attending, and thank you, Dr. Joe Donzelli. Take care.